in the female anatomy, and this is going to sound funny, but most people don't know.
I know.
You have your place where you pee out of, which is different from where your vagina is, which is different from where the poo comes out. A lot of women.
There's 3 holes.
There's 3.
Ladies, there's 3 holes back there. Have a look.
Down there. There we go.
Sorry,
down under.
Down there.
Yes.
Down
I was going
under.
to say back there. I was like,
Sorry, but down under. The following podcast is a Healthy Dog production. Welcome to the Healthy Dog Podcast. I'm your host, Dr. Nigma Talib. I'm a leading naturopathic doctor now for over 20 years, and I've consulted thousands of patients with chronic illnesses. I've had clinics all over the world, and I have a #1 bestseller, Younger Skin Starts in the Gut. Listen, I know there's a lot of health information out there in the health and wellness world, and it can be a bit overwhelming. So I'm here to set the record straight and give you my expertise along with my expert guests here in studio in sunny Los Angeles.
I only take drugs with other people who take them on a regular basis because I don't have time for that.
A lot of chronic diseases stem from mitochondrial dysfunction.
Yes. And you know what I love talking about, right? Poop.
Yes. You can ask me about my poop?
Yeah, I'm going to talk about poop.
Okay, please.
This podcast is your go-to for achieving optimal wellness from the best of beauty and longevity and everything in between, because after all, wellness comes from the inside out. Welcome to the Healthy Dog Podcast. I'm your host, Dr. Nigma Talib. Today, I have a partner in crime, a fellow naturopathic doctor. She is incredible. She is not only a naturopathic doctor, but she's also a doula. She serves as the medical education specialist at Genova Diagnostics lab, which is one of my favorite labs in the world. And she develops educational resources for also doctors and patients, and she provides clinical education to clinical providers. And she's a mama of 3. Welcome, Dr. Lahnor Powell, to the Healthy Dog Podcast.
Thank you.
Thank you so much for flying up all the way from Atlanta. I know you started early this morning, and so thank you for taking time off to be here.
It's my pleasure, honestly. Thank you for inviting me. Thank you.
I have so much to discuss with you, and as I know we had lunch earlier, and I swear the lunch was felt like 5 minutes, but it was 2 hours. So I know we have a lot to discuss, but I know that for you, you've become known for the women's health in general.
Yes.
And in particular, you've developed different programs around fertility, conception, postnatal depression and depletion. Mm-hmm. How did you delve into that world, and how did you get, into that?
Yeah,
what made you go into that area?
So I think it really started after the birth of my first daughter. I figured as a doctor, I would know everything. I figured that, I can read textbooks and I can understand what's happening, and I can kind of sort everything out from there, and I can troubleshoot little issues that pop up from there. And it became very apparent after I had my daughter that there was no textbook, there was no amount of literature that I could read, there was no preparation that I put forward to getting ready for postpartum. And as a naturopath, one of the things that we always talk about is prevention. And so I just kind of dove into literature, tried to understand what was happening to my body, what's happening to other women. And when I started communicating, hey, I'm dealing with this, I'm dealing with that, all of a sudden other women were like, yeah, I know. And I was confused. Well, how come you didn't warn me? Why didn't anybody tell me that I would be wearing diapers with my child after I delivered?
Right.
Why
Literally.
was I not told that my body was not going to transform back to how it was before I got pregnant? Why was I not told about baby blues or baby pinks, which is basically this emotional either high or low that you can experience after you deliver your baby? It's different than postpartum depression, but they estimate that almost 80% of women deal with some degree of baby blues, which is more of the depression, or baby pinks, which is more of that anxiety kind of feeling that you get after having a baby.
Wow.
And so just learning that information and then focusing on prevention, I realized a lot of it had to do with how you prepare for postpartum. You don't go into a marathon without training. So why are
is
we
true.
going into postpartum without training or preparing ourselves?
That's a really, really good point. And something and I share is both being fellow naturopathic doctors. For those listening out there, I know you're on my podcast now, but I want you to give a definition of what naturopathic medicine is before we go into this journey, because a lot of people don't really understand. We're not just doctors for prevention. We're actually doctors for treating chronic illnesses. Like basically anyone has a chronic condition, go to a naturopathic doctor. Tell us, Dr. Lahnor, give me your naturopathic doctor, because I always get interviewed and asked this question, like, what is a naturopathic doctor?
Yeah, so I like to tell people that naturopathic doctors have training in your ology, so your pharmacology, your cardiology, which is like the understanding of how the heart works. So we have a training in endocrinology, which is like about hormones and how your hormone systems work. But what makes us a little bit different than your traditional medical doctors or your other types of physicians is that we have a different toolkit. So we are able in certain states to work with medications, but we also utilize botanical medicine, which is using herbs or botanicals from nature to help improve your symptom picture. And you know what's really funny? When you look at the literature about herbs, a lot of your medications are actually derived from herbs. Just a little side
like
note right there.
Is derived from white willow.
Metformin, which is your common diabetes medication,
right,
that's also derived from an herb as well, right? So we've been using herbs. We just use it a little bit different in the pharmaceutical world. And herbs have a really nice, the way they work in our bodies when you use it as a whole plant.
The
it's a little bit
are
different, right?
They have less side effects.
Exactly.
It's interesting.
We're also trained in how to help the body like kind of maintain healthy alignment. So it's different than a traditional chiropractor. We use different techniques. We're trained in homeopathy, which is basically using something at such a small dose that technically it's not detected, but energetically it has a way of shifting things in the body.
Like cures like.
Exactly. So that's what I like to tell people. We're not different in terms of our understanding of how to interpret labs or how to diagnose or how to approach medications or how to approach a patient case. What makes us a little bit different is how we treat. And a lot of times we're going after what is the root cause. Because if I have depression and you have depression, it might be totally different reasons. You might have depression because of the thyroid issue. I might have depression because of a gut dysbiosis or an imbalance in my gut health. So we just try to get down to why do we have depression versus saying you have depression, here's an algorithm, let me give you this medication and that medication if it doesn't work.
The easy way out, basically.
There you go.
And, everyone hears root cause. I mean, you can't get more root cause than naturopathic medicine. And I think it's kind of grilled into us from day one. We go right to the gut right away. We go for the jugular. There's no everything starts in the gut. So that's one of the
that's what Hippocrates has taught us, right? One of the things that Hippocrates, which is the father of medicine, we all recite the Hippocrates oath when we graduate. It's all disease begins in the gut.
Mm-hmm.
Absolutely.
And it sure does. And we know that in more than one way. So you got into this because you realized you were not prepared.
Correct.
And you've had 3 children since, so
yes,
you're very prepared now. So I want to take the listeners through a journey.
Okay.
And the journey is going to start with what we hear all the time, infertility, which you and I do not despise that term because it means that you cannot get pregnant.
Correct.
Right? Whereas fertility is a better way of describing unable to get pregnant at this time, right? It's like suboptimum, right?
Exactly. Yeah.
And so we're going to go into that, and then we're going to talk about once you are pregnant, what to do, and then what happens after you give birth and the babies come out. All that's happened. What happens to the woman? So I want to go through that journey. Take me to the journey of women that are listening right now that want to have children but are having a difficult time. We know that the statistics are up. People are waiting to have children later. There's also a lot of toxic toxicity in our environment, for lack of a better word.
Yes.
There's been a lot of changes in hormonal fluctuations. I'm doing a lot of hormone testing, and I'm seeing some crazy test results. So talk us through like what is going on with this fertility issue with women.
Yeah, there's a lot of theories that people are postulating and thinking about, and definitely we're living in more of a toxic world right now than we ever have. That you cannot dispute that, right? But also the lifestyle that we live, we tend to live on the go a lot. We tend to have a lot of stress, which alters your body's way of making various hormones. We are seeing a lot of hormonal imbalances now, more than we have ever seen before. We're seeing a lot of even nutrient depletions, which just means you don't have enough of certain nutrients, which sounds a little funny, especially if you consider, but we have access to grocery stores. We have access to all these different foods. We're in a pretty decent state. But some of the foods, just based on the way they're grown and the way that they're prepared and even the way we cook it, it can lead to a lower nutrient quantity in that food. So we are dealing with a lot of like nutrient deficiencies, especially iron, which is really important for helping us to build blood, especially as women who have their cycles every month, and we tend to lose a little bit more than, males and those who are menopausal. I think those are probably the two biggest ones that we really are speculating that's causing this fertility challenge to arise. And then also there is an increase in the usage of medications, especially, for example, birth control, that can make it a little bit more challenging to become pregnant just because it has a way of impacting how your body makes your hormones.
Right.
So
our body stops making the hormone once we start being fed the hormone.
Exactly.
And not only that, what the birth control pill does is it depletes your key B vitamins.
Perfect.
And your B vitamins are super important in methylation.
Absolutely.
And, methylation defects, we talk about that gene, 5-MTHFR.
Yep.
And, these methylation defects can reduce your ability to get pregnant quicker. And then I think what happens is women really they just get so emotionally distraught that they're not able to conceive, that stress, that cortisol reaction. And you notice as soon as they let go of wanting to have children, they then get pregnant.
Oh, wait. Another thing that actually we do a lot that actually kind of frustrates me?
Yes.
We always blame the woman for fertility issues.
Good point.
Okay. So there's a statistic that's out and it's called 30-30-30-10.
Okay.
So 30% of those who have trouble with pregnancy and conception is the woman.
Right.
That's the problem with the woman. Another 30% is the problem with the male. And then 30% is a combination of male and female. And then 10% we just don't know.
Wow.
So we can't always just say it's a female problem. And I think that also puts a big emotional burden on us as women when we think it's your fault why you can't get pregnant. It's your fault why you have miscarriage or, or loss or something like that.
Yes.
But we have to realize that we're only one part of the equation.
Absolutely.
And so actually for clients who are interested in preconception support, I think I don't think it's right if we just see the female.
No, absolutely not. And, I started off and said, for men and women. And the problem is that you're right. Women are the ones that are always being examined and feeling this sense of frustration of like, why can't I get pregnant?
Exactly.
And, I have patients getting pregnant way into listen, I have some women in their 50s that are pregnant. And it's because they made their body healthier by coming to see me. So I should have a disclaimer now. If you don't want to get pregnant, don't come and see me. Because if you're not using protection, you will get pregnant because you're getting healthier by seeing a naturopathic doctor and following how we treat and how we get to the root cause of why this patient is not able to get pregnant. And yes, the males, we measure sperm count and we measure sperm speed, and we're seeing massive changes. A lot of these men have zinc deficiencies, really easy deficiencies to fix, actually.
Correct.
But who's measuring them?
Exactly.
I've built my entire clinical philosophy and even wrote a book called Younger Skin Starts in the Gut around one simple truth. If your gut isn't optimal, nothing else works. Genova Diagnostics GI Effects test is the gold standard in functional stool testing, mapping your microbiome, digestion, inflammation, and nutrient absorption with clinical precision. It's a crappy job, but someone has to do it. And no one does it better than Genova. Visit genovaconnect.com and use my code HEALTHYDOC15 for 15% off your first stool test. Let's go to the next stage.
Yes.
You get pregnant.
Yes.
Right? You finally
Not
get
me,
pregnant. Not you.
I'm done.
You're done. You're 3 and done.
3 and done. 3, 5, 7 years old. I'm good.
You're
I'm
good to go. So the woman finally gets pregnant.
Yes.
She's on her way in her pregnancy journey. Some women feel great actually when they're pregnant. And some women, what I find, I don't know if you see this, but women who have immune system issues, like that are getting colds and flus all the time, they're like, I've never felt better in my pregnancy. It's almost like the human body does something where the woman's immune system starts to speed up during pregnancy. Do you see that?
Yeah, so I see that. But then for the women who don't feel so great,
Right.
because we're still seeing women who are losing their actual teeth in pregnancy.
Yes,
And
correct.
the women who don't feel great, and the women who are losing teeth, the women who are dealing with shedding even during pregnancy, the women who are dealing
Hair
with
shedding.
mental emotional challenges even during pregnancy, a lot of them actually are nutrient deficient.
Wow.
So when you're pregnant, your demand for water increases. Your body has to make a whole bunch of extra blood. Your body has to now make a whole bunch of extra hormones and different things to support that pregnancy. They estimate that progesterone, which is one of the hormones that women make, it's kind of like your even keel kind of hormone.
Right.
They estimate that it increases by about 300 times in pregnancy.
Wow.
And then we have a whole bunch of other things happening. Like, do you know in pregnancy, you actually grow a new organ? Okay. The placenta, you actually grow a placenta. That was
Exactly.
not there before you got pregnant.
That's true. I never thought
So
of
we
it that way.
grow a whole nother organ, plus we're carrying a baby. And I oftentimes say, like, the baby's like a parasite because it will literally suck out the nutrients it needs for survival.
Especially
And
iron.
Exactly. And calcium. That's why we're losing teeth and the bones are deteriorating after pregnancy. Exactly. So if you can ensure that a female has optimal nutrition before pregnancy and then encourage that to continue during pregnancy, but having to ramp things up, you need more calories. You have to ramp things up. You need about 300 or so more calories per day. Then that usually fixes a lot of the issues that we see in pregnancy, like constipation, hemorrhoids, headaches. It's because you're not eating properly, you're not drinking enough liquid, and I include tea. I'll put some teas in there, herbal minty teas and flower essence teas.
Red raspberry tea.
Exactly. I love red raspberry tea. But also, women are not exercising. It's almost like you're pregnant. You have a ticket to not do anything.
That would
is
be
not
me.
the
I'm
truth.
joking.
No.
I have not been pregnant, but
I'd knock at your door
but
like,
it's even more important to move
Exactly.
because your lymphatic system now is
Perfect.
draining for 2.
perfect.
Right.
You got it. You actually have faster labor, easier delivery, easier pregnancy if you just walk 20 minutes a day. That's it. I asked you to run a marathon. Just walk 20 minutes a day.
That's pretty, that's not much to ask. But if you're not feeling well, that's part of the issue. A lot of the first trimester, that nauseous feeling and that inability to eat or keep down food, what can women do for that?
It's coming back to nutrition again.
Yes.
A lot of nausea can stem from poor nutrition, not having adequate B vitamins or minerals in your diet. And then you just have to try to play around with when you eat. So for example, my first pregnancy, no morning sickness, loved it. Second pregnancy, morning sickness hit around the time in the morning when I brushed my teeth. So I would just get up, do something else first, and then brush my teeth. Third time, morning sickness was literally from 4 p.m. to 7 p.m. So I knew that I had to cook dinner very early, and that made it more manageable, tolerable for me. But you just have to play around with when I take my supplements, what time of the day I take my supplements. Is it with water? Is it with juice? Like a lot of those things, and making sure you have adequate nutrients. a lot of times that
Give us an
solves
example.
it.
Give us an example of what nutrients women need.
You need B6. That's a very important nutrient. You need B3. That's another important nutrient. The zinc is important as well. Magnesium is important. All of these are going to be important for that specifically.
And also like low protein diets in pregnancy with the feeling nauseous. And that's a big part of it.
That
as
is
well.
a big pet peeve of mine, actually. So when you're pregnant, you need an additional 15 to 20 grams of protein per day. That's equivalent to a female bodybuilder.
Wow. That's a lot of protein.
It's a ton. And it's hard to do sometimes when you don't feel like eating, or with one of my pregnancies, raw meat creeped me out all the way. So it was hard for me to prepare meat, right? So I had to supplement with protein powders. And that's what helped me hit my protein demand. And mind you, that protein demand, it also continues through when you're breastfeeding. So you need that same high amount of protein during breastfeeding as well. And that could be why a lot of women actually feel tired. Because think about protein, it's your building blocks to hormones, it's your building blocks to a lot of stuff, including it helps your citric acid cycle, which is this energy ATP producing powerhouse in your cells. It helps it to move.
Right. It's like it helps our energy cycle, like ATP, which is for people listening, that's your energy. That's found in your mitochondria.
Exactly.
And we want to build that up. And actually, two important things you do inherit from mama are your mitochondria and your gut microbiome. So, it's super important, to have that responsibility to really take care of yourself.
Can I
during
add another
pregnancy.
one?
Yes, of course you can.
I'm also going to put in there, because I was thinking about this, and I think another thing that we inherit from our mom is going to be your diet. Your food selection, because actually babies grow taste buds, the ability to taste in utero. So so I noticed between my kids, like my different cravings I had when I was pregnant, that is their favorite food.
You're kidding.
You have to be, you have to be
Mine would be ice
mindful.
cream, I know.
Okay, so you would have an ice cream baby. There you go. There's your ice cream baby. I love it. Yeah. So you have to be careful with how you indulge in your food cravings, and try to figure out, why do I have a food craving? Because sometimes your food craving. So if you crave, let's say, ice cream, sometimes it's because you don't have enough calcium.
Right.
Right.
These are really like common sense things, but it's something to think about.
Exactly.
For people listening.
Exactly.
Okay. So nutrients are important. Taking vitamins are important. Upping your protein, like almost like a bodybuilder, really keeping that going. Water intake. Okay. So now you're pregnant, you're trotting along, you get your 3 months are gone. You're starting to feel somewhat like a human being again. And then things are going really quickly. Now you're moving into, your second trimester and then you're at your third trimester.
Yes.
How do women prepare, especially if it's their first child? Because there should be a preparation book for, like,
Absolutely.
honestly, there should be a manual. I think you're working on it, which we'll talk about in a minute.
Might be.
So in this part of the trimester, what should they be doing?
So in the first trimester, just get a routine.
Okay.
Right? Just establish a routine of walking or exercise, establish a routine of a healthy diet, establish a routine of going more green. And what I mean by that is trying to get all the toxic chemicals out of the house and out of your personal usage, like your personal care products. Try to get that out if you haven't already done so. Just start there. Because first trimester, you're trying to figure out appointments. You're trying to figure out how my body is changing, and it's a lot going on, and your emotional change. Second trimester, that's what I call the superwoman kind of hero phase, because all of a sudden you have this surge of energy.
Yes.
You're not tired anymore. That's the time when you start preparing your household for the actual coming home of the baby, right? So this is when you're cleaning up whatever space you want to use for the baby nursery. You're picking out the clothes, the theme, all these good things. And then toward the end of the second trimester, you might have an urge for nesting, is what we call it. That's all of a sudden this strong craving to clean everything. take advantage of that energy in the second trimester and that strong urge to nest or to
Wow,
clean.
I feel like that all the time. Maybe I'm in my second trimester.
I missed
constantly.
that, Jean. I missed it. Didn't hit me at all. And then your third trimester, it gets a little bit rocky. Some days you'll have a lot of energy, some days you won't. But your center of gravity is going to be thrown off because you have something that's growing in the front of your body, the baby, the belly, pushing everything around. Organs are being pushed down and smushed, and skin is expanding. So it can become a little bit uncomfortable. But this is the time when you want to prepare for what we call your fourth trimester. So most people only know about trimester 1, 2, and 3. Fourth trimester is the first 3 months after you deliver the baby. That's when you experience all of the hormonal shifts to help return you back to pre-pregnancy state. So you want to start getting meals together and freezing soups, stews, broths, things that are really easily digestible. Exactly. Warming, highly dense, nutritive foods that have a lot of minerals and nutrients in them. Seaweeds is a great example. Beef, if they eat animal products, that's a great example as well. Cooking with those things, throwing in some bags, throwing them into the freezer so that you're ready for after the baby comes out. And then also in the third trimester, visualize. You gotta visualize that ideal pregnancy. I don't care if you're scheduled for a C-section or if you're scheduled for a vaginal delivery, you have to visualize that ideal pregnancy and get your mind in that right state where it's positive and you're shutting down all the negative. Take the time, take a honey, they call it a baby moon, which is basically like a trip with your spouse. Take that time to just enjoy life before kids.
The calm before the storm.
They're literally.
From PMS to perimenopause to menopause to postmenopause, I've lived through it all. And through every stage, one thing becomes clear. Hormone fluctuations change how our bodies regulate temperature, especially at night. When your body overheats, even slightly, it disrupts deep, restorative sleep. The kind of sleep your hormones, metabolism, and mood depend on. That's why I can't live without my Rani Lounge pajamas. Their advanced technology activates natural fibers, making the fabric moisture-resistant, naturally fresh, and ultra-breathable, allowing your body to stay cool and regulate temperature the way nature intended. Better temperature control means deeper sleep, better recovery, and a body that feels truly at ease. Whether at home or traveling, staying cool, fresh, and comfortable has never felt so effortless. Go to RaniLounge.com, that's RaniLounge.com, and use my code HealthyDog15 and get 15% off your first order and experience sleep the way it was meant to be. I guess in that respect, you've got all this preparation. Are there different nutrients you're doing in the second trimester, different from the first and the second and the third? Are there anything that's different in between those three?
So that's a great question. I try to keep it very simple and keep the same nutrients first, second, third trimester. Now in the third trimester, closer to delivery, I'll start to introduce like red raspberry tea,
which is a uterine tonic.
Exactly. I'll start to introduce EPO or evening primrose oil, which is an omega-6 fatty acid that's very anti-inflammatory, but it can help prepare the uterus for delivery and things like that. I make sure that Kegels are done all throughout the entire pregnancy.
What is a Kegel for those listening?
A Kegel, oh my goodness, it's your bestie. So a Kegel is basically when you...
Can we do it right now?
Oh, absolutely. Here? I'm doing it right now. Can you see?
I'm going to do it too.
Can you see?
Yep. No, I can't.
Yeah, you can do it whenever you want to. So a Kegel is basically a way to help strengthen that pelvic floor. Okay.
Right.
So when you look at the body, we have what's called a pelvic floor, and that's what helps to keep in the uterus and everything like that in its correct place.
Keep them all in the content.
Exactly. So when you are pregnant, everything is stretching, everything is expanding, everything is getting bigger, and it can weaken your pelvic floor. So if you've ever heard of women after they've had babies, when they laugh or they sneeze, they tinkle a little bit. Right. Or we
also
call it
in menopause.
Well,
so not me, not mine.
I got something to look forward to, don't I then?
Yeah, that's another story.
Yeah, yes, ma'am. We'll talk when I get there.
Okay.
But so the Kegels will actually help to strengthen that pelvic floor so that it can help you with not only delivery of the baby, but help things to return back to normal after you are done.
And how often do people do these Kegels? And
you do them every day.
Can you describe it? I can't describe it.
Yeah, so it's like you try to stop the flow of urine is how I describe it to people. But you
So if you're
don't want to
peeing,
contract your bottom.
Okay,
So you
just
wanna-
your front.
Exactly.
Okay.
So in the female anatomy, and this is going to sound funny, but most people don't know.
I know.
You have your place where you pee out of, which is different from where your vagina is, which is different from where the poo comes out. A lot of
There's
women,
3 holes.
There's 3.
Ladies, there's 3 holes back there. Have a look.
Down there. There we go.
Sorry,
down
down
under.
there.
Yes.
Down
I was going
under.
to say back there. I was like, woo,
Sorry,
wait a second.
put down under. Losing
There's
it.
3.
I'm losing it.
Yeah. And so we want to try to contract that muscle so that we can have that strength for that process. But all you have to do is like Kegels, like 20 minutes a day. There's apps on your phone, for heaven's sakes. And you push little buttons and they're like squeeze and you squeeze and it's like relax and you relax. Like it's so easy nowadays. And just like break it up into little 5-minute increments. You can do it while you're driving. We just did it here. Nobody knew.
I'm still doing it.
Oh, wow. You're a champ.
I'm trying to get brownie points here.
Well, you definitely have brownie points.
I'm worried about the menopause.
Yeah. And it actually helps postpartum too. Don't forget, you want to continue postpartum.
So you want to continue doing the Kegels.
Correct.
You want to continue on your nutrients.
Yes.
Maybe you want to start in your 3rd trimester doing more like red raspberry teas, getting your uterus ready
Correct.
for tonification for, and I think in the last trimester, what about upping your magnesium? Can you do that or is that too risky?
So there's a little controversy as it relates to upping your magnesium, but I always remind people that magnesium is a beautiful mineral. We call it the mama mineral because it's that
love
important.
magnesium.
And
I would marry magnesium if he was a man.
I think we should aerosolize it.
Yeah.
I think that would be good too. Little magnesium plug-in or something.
Exactly. I agree.
But most people are deficient in magnesium.
Yes.
You get magnesium from your food and your water, but we filter our water and our food is farmed differently than it was back in the day. So the amount of magnesium that we're getting, it's just not the same. It's lower. And so the concern of getting in too much magnesium, which can induce labor, that's tough. Even your prenatals have magnesium in them. So it's tough to hit the amount of magnesium.
You'd
that
have
could
to do a
induce
heck
it.
of a lot of magnesium. I feel like magnesium would be really good at relaxing.
It is very
the
good at
muscles.
relaxing. Absolutely.
And also the glycine component in the magnesium glycinate, when it's mixed with, serotonin and the, bringing down homocysteine. I think those are really important aspects for women. Also preventing preeclampsia and high blood pressure, right? So I think that's a really good one to add in. And then so the 4th trimester, when you're talking about adding all the warming foods, which in naturopathic medicine we learn in traditional Chinese medicine, supporting the yin, and supporting like warming foods, not cold salads, not cold anything. Everything has to be warm. And the beef is because you've lost
so much of the blood.
You've lost the blood. You've lost that energy, right?
So it's about 2 cups of blood for a vaginal delivery, 4 cups of blood for a C-section.
Wow.
For one
so
baby.
It's double the blood loss for C-section.
Correct. Yeah.
Incredible. We're going to get to that in a minute because I want to know all about that. Okay. So now you're in the birthing room, right?
Yes.
You're giving birth. You're at that 3rd trimester, your water breaks. You hear the story of the water breaking.
Which doesn't always happen, by the way. That's not always your first sign.
Okay. What is the first sign?
So you want to download one of those contraption apps trackers on your phone because we don't have to write it down in paper anymore.
There's a contraction app?
There's several of them. And you literally, when you have a contraction, you hit go. And when it's done, you hit stop. And it measures how frequently, are they consistent? Because you want to tell the difference between what's called Braxton Hicks, which are false contractions or practice contractions versus the real deal, right?
How would you know?
511. That's all you have to remember. 511.
Okay.
So every 5 minutes, I have a contraction that lasts for about a minute. 511. Some people like 411, but 511 is pretty safe. And that gives you enough time to get to your birthing facility or call the right people and things like that. So that's what you're tracking. And again, your water breaking is not always the first sign. Some people have what's called back labor, where they just have a terrible backache and they're like, oh, it's so uncomfortable. That could be a sign of your labor is starting. So this is why you want to have somebody on your team that understands the different
your body.
phases.
Yes.
Exactly.
Interesting. So now the woman is going into birth, right? So
Yes.
she's made it to the hospital. She's going into birth. What are her options in terms of,
Yeah.
you know, some people are like, do I get an epidural? What, you know, how do women make that decision? And why is there so much guilt around this? You know?
I don't appreciate the guilt.
Yeah.
I think it's very disrespectful to women and to their journeys. I personally had 2 C-sections. My first baby was frank breech, so she was Sunny's like she was in the wrong position, right? Yeah. So when you deliver a baby, the head's supposed to come out first. Her feet were going to come out first,
Right.
And then I had meconium, so she already passed her first bowel movement inside of me. Yummy, right? So
True
that
mother's love.
honestly, so that set me up for, instead of having a water birth that I was prepared to have in the hospital, that set me up for having I call it a semi-emergency section because it wasn't like an emergency, but it was definitely unexpected, right? My second child, I was given information that said once when you go in labor, do not eat. What did I just tell you about how important nutrition is? How important do you think it is in labor? How many calories?
They tell you not to eat?
Because I already had a C-section. So they were concerned that I would have to get another C-section because when you already have one, your risk for another one increases.
Right.
So they told me when you go in labor, do not eat. That was such poor information. I had
How'd you get
no
the energy?
7 centimeters dilated. I was done. I had no other option. My baby was starting to show signs of distress. Third pregnancy, I was ready for it. I was ready for
3 times
it.
the charm.
Yeah, third pregnancy, I actually had a vaginal delivery unmedicated. All they had to do was break my water. And I mean, I trained myself how to push. I had chiropractic care on board. I had acupuncture on board. I had my nutrition supplements. Everything was stacked up. I had it right, according to what my body needed. I was moving. I was ready for it. And I pushed that little boy out.
Oh.
And it was such a feeling of just, I did it. Right?
Wow.
But in terms of your options, this is why you have to, if you deliver at home, at a birthing facility, or at a hospital, you need to ask ahead of time, what are my options? Asking what are my options while you're in labor, that's a joke.
It's too late.
It's way too late. And you need to educate whoever's there with you what you prefer. So whether you want an epidural, whether you want to try pain medications, whether you want to deliver, do you know most beds in the hospital have a standing bar where you can dangle a bar? All they have to do is attach it. So you have to know these things. The only way you're going to know it is if you visit the facility and ask those questions. You don't have to get all of the different medications, procedures that they offer at the hospital. You can delay some of those, but you have to educate yourself.
I want to share something that could literally slow down how you age, inside and out. Let's talk about hyperbaric oxygen therapy, or HBOT. You've probably heard of it being used for athletes or wound healing, but what you may not know is the latest research is showing powerful benefits for cellular regeneration, brain health, and even reversing some biological markers of aging. Hyperbaric chamber works where you breathe in oxygen at higher than normal pressure. This process stimulates your tissues with oxygen and beyond what your body can normally get in. That extra oxygen jumpstarts your cells, helps natural repair processes, reduces inflammation, and boosts collagen production. It even stimulates the growth of new blood vessels. Studies have shown improvements in telomere length, which are kind of like protective caps on your DNA that shorten as you age. Longer telomeres, that's linked to healthier aging. If you're feeling the effects of aging, maybe it's slower recovery, brain fog, or skin that's lost its luster and glow, hyperbaric oxygen might be a powerful tool to help you feel sharper, stronger, and more vibrant. Go to oxyhealth.com, that's OXYHEALTH.com, and type in discount code HealthyDoc10 for your first order. Yeah, I mean, I think that's important. It's just a lot of women don't know that they can even ask those questions. It's like lucky if you get a hospital bed, to give birth. Okay, so those are the options. There's preparing for that in the best way you can. Make sure that you have enough energy, obviously. Mm-hmm. And by this time you're ready to go. It's game. I mean, some people have it so easy. I have friends that have just literally bloop. Just came out, and then some that, were in, I had a patient's sister who basically called me and said, listen, I had, sepsis, from a C-section. And so it just feels like a lot of people are getting C-sections. Can we talk about C-sections and why is everyone getting a C-section? And is that okay, getting a C-section?
So there's a risk. There's always a risk.
Higher risk with a C-section.
Absolutely, because you're breaking skin barriers. So you're cutting through skin, actually multiple layers. This is, from my understanding, this is the single surgery that goes through the most layers. You got to go through the skin, the fascia, the abdominal muscles, the uterus, the placenta, just to reach the baby, right?
It's a lot of layers.
It's a lot of layers. So there's a risk for basically infection, and there's also a risk for bleeding. Remember, I just mentioned you can lose up to 4 cups of blood with a C-section delivery. So you have more blood loss.
Versus 2 cups with
a vaginal delivery. Exactly.
Right.
Now, C-sections, we oftentimes hear them recommended because, for example, we're measuring your baby at too big of a size. Do you know that measurement can be up to 1 to 2 pounds off?
Wow. So they don't really know the size of the baby.
We really don't.
You don't know.
We can guess pretty well, but we don't know. Okay. And then women, our parents and beyond and before, they've been delivering 12-pounder babies like nothing for a while.
Yeah.
And we're getting nervous about a 6-8-pound baby.
Yeah. Well, we're in the United States of America, and the statistics are shocking.
They are.
That the United States of America, I think, comes, as you said, out of hundreds of places. The United States came in at 55
for maternal mortality. So it's around 32.9, just rounded off to 33 maternal or mother deaths per 100,000 live births. That's about 1,200 women, and that does not include how many endure complications. And if you look at the UK, you look at Europe, you look at Canada, you look at Russia, their death rate is less than 10 per 100,000 live births.
Why is that?
They estimate that about 2/3 of deaths happen after the baby is delivered. Okay. So we don't have, in the US, we don't have a solid postpartum care plan or track. We're focused on the baby, and that's beautiful. But what about the one who gave birth to the baby, who gave life to that baby?
Right.
We're not tracking how much blood they're losing. We're not measuring their blood pressure. We're not checking their vitals to make sure they don't have an infection. And those happen to be the 3 most common preventable reasons that women are losing their lives. The other one is pregnancy complications that you just really can't account for. But if we have a large percentage that are preventable, what are we doing? But the good news is that actually California, they're actually the best. They have statistics more similar to like the UK and Europe. But in Georgia, where I live, not so good.
And not so good for women of color as well.
No, it's actually a lot higher for women of color. It's actually around 70 per 100,000 live births. Remember, the average was about 33. Now we're jumping up to 70. Double. Yeah.
So women of color have double the risk.
Exactly. And let's put on top of that, because most women are having babies, later on in life, in their 40s and above, right? The risk increases to over 128, I believe is what they say, deaths per 100,000 live births of babies.
That's alarming. It's
scary. And I watched something recently on social media that said, if we look at the death statistics per 100,000 for mothers, the maternal mortality rate, it's actually one of the most dangerous jobs that you can hold in the U.S.
Wow.
And I'm talking about, that's including skydivers and our police force. It's more dangerous.
That's really scary.
Mm-hmm.
So now, if a woman makes it through the pregnancy, right? I mean, I know that sounds really morbid, but listen, we're talking facts.
Yeah.
That statistic is pretty higher than I would have imagined, and I had read that research a couple months ago, and it was shocking. I couldn't believe it. And once a woman then has her child, she then has to go through, like you said, the fourth trimester,
Yeah.
you know, the nurturing stage.
Yeah.
And women go into this stage with postnatal depletion. And if you don't deal with it, the postnatal depletion can last 10 years plus.
Yeah.
That is crazy. Talk to us about that. What can women do once they've had the baby?
Yeah.
And we talked about the warming foods.
Yeah.
We, you know, what else can they do to support their postnatal depletion, and what tests can they run?
Yeah. So first thing, you have to have a community. If you don't have a supportive community around you, you're increasing your risk for postpartum complications, especially as it relates to mood. But postnatal depletion, after birth of baby depletion, a lot of us look at it through the nutrition standpoint. We look at it through the hormone standpoint, and that just that your mother is exhausted and taking on an entirely new role of life, right? Being the caretaker of an infant that literally cannot do for themselves. And so what can we do? We have to do those warming foods. We have to do the resting. I think they call it the 5-5-5, which is 5 days in the bed, 5 days on the bed, 5 days by the bed. So it's like this postpartum time where you get to relax, recover, and just focus on baby, and everybody else in your community provides you with the food, the love, the nurture, the care, and everything like that. We have to make sure that our family and our friends are vigilant at making sure we're eating well, because we're busy pumping and we're tired. We're trying to figure things out. Our community has to make sure that we're being supported. And unfortunately, the first check for most women, if they had a vaginal delivery, is going to be around 6 weeks? That's too late. That's way too late. They define maternal mortality up to 42 days after you deliver.
Wow.
And we're seeing people at 6 weeks. That's too late. In other countries, do you know they have nurses that deploy to the house of the mother that just delivered? In other cultures, the mother actually moves in with mother-in-law or auntie, or mother-in-law auntie moves into the house.
Yeah,
and
not
it's
like that in the US.
massage.
Yeah.
Therapies, it's a whole bunch of just beautiful old school techniques that have stood the test of time that we're losing.
It's almost like women have become like these machines. You know, you just have a baby, you go back to work.
Yeah.
And we're seeing a huge statistic of women with postnatal depletion, postnatal depression.
Yes.
You know, and they don't even know they're in it because a lot of these symptoms are not accounted for. And, you know, they're just not part of a diagnosis per se.
Yes.
Right. And so what can we do? I know you work for Genova Diagnostics, and I use Genova extensively in my practice. You know, I use all the stool tests. My patients know me when they already know they're going to come to the poop doctor. You're doing a poop test, whether you like it or not, because all disease starts in the gut. But that, you know, leaving that aside, you know, it's super important to measure the hormones.
Yes.
Can you walk us through some tests that Genova has that really measure all the important factors that women can do pre-pregnancy and also post? Right. I think there's a pre and the post. You can't do anything in the middle because, you know, your hormones are like, woo, you're in Mars. So the pre and the post pregnancy, I think, are the times when women that are listening now is when you really need to put your hormones to the test, because that's where everything goes off.
Exactly.
Never well since pregnancy, right? All these things get depleted, your thyroid, your adrenal glands, your nutrients, your organic acids. Let's talk about that.
Yeah. So that's a perfect list, the beginning of the list right there. So we want to do nutrition testing. We want to see how are your vitamins and your minerals. Do you have a good balance of those nutrients? We also want to look at stool testing because, believe it or not, your gut is also a very critical component in helping you to clear out your hormones. But imagine if you can't break your foods down or you can't absorb your foods, well, then all the beautiful foods that you're putting into your body, you might not be taking advantage of those nutrients. So gut testing or poop testing.
So do a GI effects
exactly.
right after.
Stool test.
Okay.
Exactly. And then also for the hormone test, we have a test called the Endo Plus, which allows you to evaluate the endocrine system. So the endocrine system is like hormones, communication, and talking. And part of that endocrine system is your thyroid, which is that butterfly gland that sits right here in the front of your neck.
Yes.
You also
Very vulnerable organ. If you think about it, it's exposed to the environment. It's such a sensitive, and it's very sensitive.
Exactly.
Especially women after giving birth.
Absolutely.
Such a high percentage of thyroid issues.
Not only thyroid issues, but also women flipping into having an autoimmune thyroid issue. Basically, their body is mistaking themselves as foreign and it's attacking their thyroid.
Yes.
But not only the thyroid, but we also want to look at, like you mentioned, the sex hormones. So the estrogens, you want to look at the progesterone. So estrogens is what gives us our lips, hips, and breasts, right?
Ooh,
progesterone.
And vision.
Yes, ma'am.
Estrogen equals.
Yep. And we love our heart, right?
Yes.
And progesterone is your even keel hormone.
Okay.
But women also do make androgens like testosterone. That's not just a male hormone, right?
Not just you, Dante.
So there you go. So it's important for us to measure that balance. A lot of women who are having trouble with fertility, it's a progesterone issue or a hormonal imbalance issue.
Progesterone is progestation.
I love that. I never thought of that. So going to take that one. Thank
That's why a lot
you.
of women are progesterone deficient,
Yes, they are.
and why they cannot get pregnant, and then they're called
or they
infertile.
lose the baby early within like the first 6 weeks or so.
But
a lot of
nobody's
it's
measuring
progesterone.
that.
We usually don't measure it until their third miscarriage or beyond or something like that.
That should be
which
done
is like-
first. So the Endo Plus test is a hormone test. If you're planning on getting pregnant, that is the one
Yes.
test you want to start with.
Exactly, because it's going to look at those, and it's also going
Everything.
to look at your adrenals too. So
Oh, gosh.
your adrenals sit on top of your kidneys. They're located
cute
here in the
little
back
glands.
of your, like kind of in the back area. We have 2 of them, one for each kidney.
Mm-hmm.
And everybody thinks about your adrenals as like the cortisol, the
Right.
stress hormone, the one that makes me gain weight. Okay, yeah, there's some truth in that. I'm not going to lie. However, you need to be able to mount a stress response and turn it off.
Absolutely.
But what's happening is women, it's like a light switch. Women are turning it on to manage the stress, but they're forgetting to turn it off.
Right.
And so their ability to produce appropriate cortisol levels, it just ends up being a bad story, and they live very hypervigilant lives. So if you see a woman who's having trouble with conception or who's interested in a conception journey, test the husband or the male partner as well, right? But also postpartum, around 6 or so weeks, I think that's another important time where we can run those tests as well. Now, don't forget your traditional blood work that looks at your heart health, that looks at your blood cells and all that stuff. We still want to run the traditional testing, but these are add-on tests to really optimize people.
And they're tests that are not done by your conventional
Correct.
medical doctor. Naturopathic, I, as a naturopathic doctor, run these tests all the time. But what I love about Genova is it's specifically measuring these analytes in
Exactly.
the urine, the blood, and the saliva. So you're collecting free hormone data, not just hormone that's in the blood at one point in time.
Exactly.
And so it's worthwhile to run the Endo Plus test prior and then after. And then obviously run your other bloods to see, are you iron deficient? You've
Correct.
just given birth.
Exactly.
Iron deficiency is one of the huge problem post partum, and it can cause hair loss. It can cause depressive like symptoms, fatigue, so it's
Those are actually the symptoms that you want to look for with postnatal depletion, the exact ones you just mentioned. Those are some of the trigger symptoms that you should start thinking about. Oh, is this postnatal depletion? Hair loss, hair thinning, skin looking older than what you think it should look like, wrinkles and things like that. I think those are the tall tale signs, and it's hard to put it together because they seem unrelated.
Right.
And we sometimes in our society say, oh, it's just normal postpartum. We kind of almost gaslight the mama, and it's not fair. But those exactly symptoms that you mentioned, that's what we need. When we see that as clinicians, we should start to think about postnatal depletion.
True wellness lives in the smallest details: the air you breathe, the water you wash with, and the surfaces you touch. That's why Koala Eco, with their beautiful botanical ranges for home, laundry, body, and even pets, is the only brand I trust. Elegant living without compromise. Visit koalaeco.com. That's KOALAECO.com and use my code HealthyDoc15 for 15% off your first order. I run on every patient before they get pregnant and after. I run an adrenal stress test, the Genova adrenal test, because it measures diurnal variations, which is it's going to measure your cortisol first thing in the morning, at noon, at afternoon, and in evening.
Exactly.
And so cortisol levels are supposed to drop. And I see a lot of women, their cortisol levels are like through the roof at night. So they're wired, but they're tired.
Yeah.
And, that is the depletion. Just the mere fact of giving birth apparently causes massive adrenal burnout. Just the process of birth. I mean, you talked about your journey when you hadn't eaten enough. You weren't able to push through it. So it's a really important thing to measure your adrenal glands and, have that looked at because it's a huge part.
Yeah.
It's a huge part of the depletion part. The depression part is something we're most familiar with than
Correct.
depletion. Talk to me about that. What is the percentage of women that go through, from what we know from the research, what is it for women with postpartum depression?
Yeah, so maybe remember we talked earlier about the baby blues and the baby pinks. So 80% have baby blues, right, or baby pink. And then we move into more depression, and it's not greater than 15% in terms of what I've seen recently that actually can go on to having postpartum depression. But we have to look for those signs because, again, they can be very subtle. Right. They can be gaslit as traditional, normal, you just had a baby kind of things. They become very weepy. They cry. They're very emotional. They might have feelings of just not worth anything or not wanting to eat or not wanting to
harm their child too,
and
right?
When we start to have those types of symptoms, we need to pick up the phone and get help immediately. But there's also something called, and it's not really common, but you hear about this one more on the news, which is postpartum psychoses. So you hear about women who actually harm their child, but they seem like the perfect lovey-dovey mother and nobody understood how that could be. We have to look for these. We have to teach our spouses, we have to teach those around us what these symptoms are. And again, it's hard to detect something if a woman goes in for an appointment one time at 6 weeks and they don't know when the next time their appointment's supposed to be. And at 6 weeks, you get a screening test that says, you either pass the depression scale or you don't. But women have to really look at themselves and be honest with themselves. And it's okay if you're not okay. You got to get help. And I think that's super important. And I think what we might need to start doing is doing some polymorphism, some genomic testing to see if some women have this COMT gene, because I know this gene increases your risk for these kinds of activities. So I think there's what I'm hearing here is a lot of preparation that can be had. It's all about the prep.
It's all about the prep.
Yeah. So stop worrying about baby nursery color and getting all excited on that. Let's prep for postpartum.
Have we missed anything? You want to add anything?
I think I just want to add that a part of your healthcare system, it's beyond your doctor or midwife. You should have a massage therapist. I got a massage after my third child, and I went from puffy to feeling amazing. It helps with the drainage of all the excessive fluid tissue inflammation from the delivery process and from the birth. So you need a massage therapist on board, get an acupuncturist on board. I mean, they can help even with causing the baby to flip into the right position. Even sometimes they can help with sciatica, which is like nerve pinching and twinges that can run down the leg and make it very uncomfortable. Get a chiropractor who's web certified, WEBB. That means they have extra special training to help women who are pregnant and to help make sure they're in good alignment. All of these things I think are very important, and keep your toxic load low. So don't get your fingernails done when you're pregnant.
Yeah.
Okay, I'm done.
One more thing. Exactly. No gel manicures. Just saying. I know we're running out of time here, but I wanted to talk about one more thing because I get really, a lot of my patients get excited about this, is the placental encapsulation.
Yes.
Can we talk about that really quickly? Tell everybody what
Absolutely.
that actually means.
So placenta encapsulation. So you have somebody who has been through the training. After the baby is delivered, they come and they collect the placenta. So if you're getting placenta encapsulation done, number one, you need to get a placenta encapsulator way ahead of time. Because your
Not on the
delivery,
day.
not on the day, not even a month before, like way ahead of time.
Yeah.
Because they have to plan for the delivery because they have to collect the placenta within a certain time frame. And they basically clean up the placenta. They go to the hospital, they get the placenta, they clean it up, they add some herbs, they dry it, and then they grind it into a fine powder, and then they put it in capsules. And then they write on there, how to take the placenta encapsulation pills. And the thought is that it's helping you to replace some of that iron, some of the nutrients that were lost from pregnancy. It's also helping you to rebalance your hormones. So women who do placenta encapsulation, they actually notice that their postpartum recovery is a little bit more smoother. So I think it's something that we definitely need to look for somebody early in the process so we can get them locked down.
Also anti-aging.
Oh, hello.
Give me some of that
Absolutely.
placenta.
I know that's right. Yes, ma'am. Yes, ma'am.
It's really good for, anti-aging. And yeah, I've heard amazing things about it. So I wanted to add that to it. But before we go, I want to ask you a question.
I'm listening.
One more question.
I'm scared. Yes, ma'am.
Well, I ask all my guests this. I mean, you're going to be a pro at this. Like out of anyone I've had, like you're going to be like the A+ student.
We'll see.
How many bowel movements do you think is normal to have per day?
You need 1 to 2 bowel movements per day, not per week, not per month, per day. They need to be well formed, not too loose, not constipated. You should feel a sense of satisfaction after you pass a bowel. And if any time it changes in consistency, smell, texture, any of that, yes, I'm asking you to look at your poop. But if it changes, you need to alert somebody. It doesn't necessarily mean something horrible is happening, but it could be. You need to alert people if you're seeing a redder stool or blood, or if you're noticing that you have hemorrhoids, or if you're noticing that your bowels are too loose. You have to let somebody know so we can run testing to see what's going on, like a GIFX stool profile.
That was the best answer I've had out of 12 guests that I've interviewed. And I knew I would have that because you are a naturopathic doctor extraordinaire. Aww. It has been such an honor to have you on the show, and
so
just
fun.
Being able to nerd out and geek out with a fellow naturopathic doctor. I could talk to you for hours. And so I wanted to also ask you to, let people know where they can find you, because I know you do work with patients who are considering preconception during their birth, and your doula as well. So where can people find you if they want to take, to hire you, or to, that's not that, to bring you on board as part of their team? Hire you sounds like, what am I, a salesperson? No, but if they're lucky enough to have someone like you, which is, hard to find. I know a lot of women struggle. Where can people find you?
So my website is Okana Care. See, did you notice it? The OC?
Oh, I see that. I love it.
So Okana Care, OKANA Care, CARE.com. That's the website. On social media, on Instagram, it's Okana Postnatal Care. And that's my handles right there.
Okana Postnatal Care.
Mm-hmm.
Follow her on Instagram. She's going to be doing some extraordinary work, and she also filled me on a little secret that I'm going to share with you today. That she has written a book and is in the process of finishing it. It's called Growing Together. Yeah. Literally growing together, growing informationally. I think it's going to be one of those journey books that every woman who wants to conceive or is pregnant, is something that every woman needs to read, because the way you describe, and I looked through it today, and
sneak peek.
It's something that we all need, and I haven't seen anything like it. So I'm really excited for your book to launch. Hopefully you said sometime in May.
Yes, exactly.
2025.
Yes, correct. Okay. Yes. So I'm super excited about it. It takes women basically throughout their pregnancy from week 5 all the way to the 12 weeks postpartum, checklists and journaling and incorporating the mental emotional aspect. So I'm super excited about it. Yeah.
I am super excited. I'm super excited for the women that are going to be able to read this book, who are going to be going through this journey much easier than they would have if they hadn't read the book. Thank you so much, Dr.
thank
Lahnor
you.
Powell, for being with us today. It was such a pleasure. Cheers.
Oh.
Thank you for joining us.